Hello, everyone. My name is Rebecca Sarr. Today, I want to talk to you about how to recognize the warning signs of stroke before it actually begins so that you can help a loved one prevent or minimize the risk of them experiencing a disability and possibly save a life. You all know stroke is experienced among adults, but there is no age limit as to who can experience stroke. It can happen to anyone, which is why time is essence to getting effective treatment and recovery. Several years ago, my dad, at the tender age of 56 years old, died from a sudden heart attack. I was devastated and in total shock. The fact is, he didn't have any prior history of heart disease. He was not ill or anything. That just happened suddenly. And which is why this topic means so much to me, because I don't want anybody else to experience what I experienced. I felt powerless, helpless, that I couldn't do anything about it. And from that point forward, it became my motivation and my quest to continue to really learn and help others and help myself so nobody has to go through what I went through. You may be asking, what is stroke? So stroke occurs when the blood flow through the artery to the brain is cut off in two ways, either by a blockage like a clot, or when there's a damage to the blood vessel. When this damage occurs, it causes bleeding in the brain tissue. So stroke is the leading cause of disability among adults. It is the fourth common cause of death. Did you know 80% of stroke is caused by blockage? The good news is we can actually minimize or prevent that situation through lifestyle changes such as diet, exercise, and so forth. So that's very great news to know. So some of the risk factors of stroke include high blood pressure, which is the greatest risk factor. I always ponder the idea that maybe perhaps my father may have been experiencing high blood pressure, even though we were not officially aware of it, but possibly he could have had high blood pressure and just not aware of it, because he really didn't like going to the doctor or going to the hospital. He really didn't have to. So maybe he had hypertension, but he just was not aware of it. Who knows? Nobody knows. But I know that I'm committed to making sure nobody experienced what I went through, and to know as much and help myself and help others to not experience what I went through, feeling helpless and powerless. So the goal is to empower people to be able to help their loved one and help others by the simple means I'm going to show you today. Smoking is another risk factor of stroke. Smoking doubles your risk of having a stroke. And if there's a woman who is smoking and using oral contraceptive, that further increases her risk of having stroke. Another risk factor is diabetes. Diabetes doubles. A person with a diabetes, their risk of having stroke is double as well. Heart disease, which is what my father experienced, that also can cause a stroke. Irregular heartbeat, or the heart rate going too fast, and so forth. Any heart disease will increase the probability of getting a stroke. There were many other factors, but one thing I thought was quite interesting when I was researching was the fact that the location of someone could actually increase the probability of having stroke. For instance, people living in the southeastern region of the United States, such as Georgia, Alabama, Arkansas, Louisiana, Mississippi, North and South Carolina, Tennessee, those places, it also increase the probability of having stroke. I thought that was quite interesting because I didn't expect that. So when the key reason why we're here today is to know this warning sign, which is a very simple acronym: be safe. That's how you determine the warning sign of stroke, so that you can quickly help a loved one, prevent the disability, and possibly save a life. Because you know, with the brain, once a brain tissue is damaged, you cannot repair it. So that's why it's really critical to make sure you act promptly. So B is for balance. You want to check the balance of the person. Make sure they don't have an unsteady gait. If the one limb is leaning to the other side or is weak and experiencing numbness, that's an indication. E is for eyesight. If the person has a sudden changes in vision, blurred vision, stars in their eyes, not seeing one or both eyes, that's an indication. The next one is F for facial drooping. If the person, you ask them to smile and the smile is uneven or drooping to the side, that's an indication there's a problem. Arms, you ask the person to lift their arms up. If they cannot stay symmetrical, it's a weakness on one side, they're having difficulty lifting one of their arms, you know there's a problem. Because with stroke, like I said earlier, if for instance they're affecting the right side of the body, the left side of the brain will be affected. So if they're experiencing weakness on the right side, the left side of the brain is affected, and vice versa. So you want to make sure you check that. S is for speech. If you ask a person to repeat a phrase and they cannot repeat that phrase, or they seem confused and not comprehending, that's an indication. If you experience one or any of these symptoms, that person experience one or any of these symptoms, this is the time to call T for time, to call 911 immediately. You want to call 911 because you cannot drive that patient as you don't have the proper medical equipment, or that person cannot drive his or herself to the medical facility, because time is of essence. Ideally, within 3 hours upon recognition of the warning signs, will be able to help improve the probability of effective treatment and recovery. So with that said, I would like to conclude that it is important to act promptly. Call the emergency, because they have the medical personnel that will actually be treating your patient, the person, from home all the way on the route to the hospital. 3 hours is ideal, and that could actually prevent a person from experiencing a disability or minimize the disability extent and improve recovery time. Knowledge, I would say, is potential power. The reason why I said that is you can have all the knowledge, but if you don't use it, you just accumulate it, it's not going to be any use. Do you know some people that know a lot about everything, but they can't act on anything? So knowledge is only power if you can execute it. So today, please use your knowledge of being safe to help serve yourself and help others, so they cannot experience what I went through. B for balance, E for eyesight, F for facial drooping, A for arms symmetry, S for speech comprehension, and T for time to act promptly to call 911. Thank you for listening. It was great sharing space with you. Comment below, what do you think? If you have similar experience, please help a loved one to feel safer and help them to not experience disability unnecessarily or save a life. Thank you.